So this is round 2. So I'm going to be joined by Amanda, and today our topic of conversation is going to be scars, and more importantly, can scars be healed? So as I was looking at the title of the talk, I thought that's quite a philosophical title, isn't it, for Monday, Can Scars Be Healed? Because some, whether they're physical or mental, can't be, but we can reduce their effect or their impact on your life. Now, for myself, having suffered with acne as a teenager and as a young adult, not the worst kind, I had spots everywhere as a teenager, they were all over, but I did get some residual scarring along one side of my face, especially over the cheek area. On darker skin that can sometimes show up a little bit more. But what I have found that over time, those scars are reduced. For example, when I get dehydrated, they come up. So scarring and acne are some things that are very important. And that's why I chose this topic. So rather than steal all of Amanda's thunder, there she is. Hi, Amanda.
Hello, how are you?
Good. So I was waffling for a bit and just talking about how I've got some residual acne scars myself.
Okay.
But this is the first time we've actually met.
Yes, it is. Acne scars are difficult to treat in darker skin, aren't they?
Yeah, exactly. So Amanda, why don't you just give anyone that's watching a brief overview of you and where you're based?
So my name's Amanda Azzopardi. My name's Amanda Azzopardi from Amanda Azzopardi Aesthetics. I'm based in Liverpool, and I'm an advanced nurse practitioner in emergency medicine. I work in the NHS still, and I've got my aesthetics business as well. I won't say alongside because I think it takes a lot of my time.
It does. I share your pain. And how long have you been doing aesthetics for?
Quite a few years, in and out. I started it when I was in Australia, and I got out of it very quickly because it's a very different market over there. And then I came over here 10 years ago, and I've done I did my master's over here. I was a midwife in Australia, and I did quite a bit of aesthetics training in the UK. I've trained down in Harley Street, and I've done a lot of training in Manchester. So all over the place. It's just continual training.
Awesome. Well, it is, and that is part of the job, isn't it? Something that we're going to discuss in more detail. That just doing that foundation course way back when for 2 days did not get us ready for the whole the diverse world of aesthetics.
I think it actually terrified me, the 1-day course.
Yeah. No. Exactly.
I ran a mile and had to do 1,000 more hours before I could actually do anything.
Right. So let's put between us those 1,000 hours to good use, and we're going to talk about scars. So it's going to be kind of, for anyone watching, it's going to be quite informal. It's going to be very much a discussion. Anything that you pick up from either myself or Amanda talking about and you'd like more detail, then please DM us or message us, say that you found it really interesting and you'd like to know more. But Amanda, just what sparks my interest, and I'll just let people get the context of why we're doing this, is that you're quite good on social media in terms of you do showcase some of your treatments, and one of them, for example, for scar treatment was Carboxy Therapy. But rather than focus on that, why don't you go first about your approach to scars, and maybe give an example of someone that's come to you, and then how you approach them generally.
Yeah, absolutely. So when I'm approaching a scar, I like to have, the first thing we do is I take a full good medical consultation. I need to know more about the scar. I need to know about its age, about how it was formed, and the background of the scar, any treatments that have previously been undertaken on the scar. But not just about that, I need to know about the patient's medical history, about their surgical history, any surgeries that they've actually had on the scar, any surgeries they've had in general, or any medications they're taking. Because these can all affect the treatment that I could potentially offer them. And it may limit or improve the treatments that we can provide for them.
So I mean that's such a key point, isn't it? In that for both of us as healthcare professionals, is that the consultation is that key component of not only understanding the patient's ideas, their expectations, their concerns, but it gives us time, doesn't it, to start formulating our own minds. And I know that we've discussed this before, but I think the key word and the take-home message for anyone watching, especially patients or anyone considering scar treatment, is combination therapy. So go on, what is there's always a template, isn't there, in our minds about what the combination therapy is the core foundation is going to be. So what do you tend to go with?
There is. There's a lot of things that I like to combine together. One of the very basic things I like to start with is microneedling, because I think this gives you a mechanical breakdown of the scar tissue. And that performs two jobs. I think we need to mechanically break down the scar and get the scar tissue broken down, optimize the cell function, release some epidermal growth factors, and get the collagen stimulated. When a wound occurs, you get scattered, scared collagen, all crazy in different formation, and we need to get it to lay nicely to soften the wound, soften the external appearance. So I think the mechanical injury of microneedling is a really big bonus that we have on our side for scar healing. The other thing is we need to induce like regenerative healing. So I like to use IPRF, so our own platelets going back into our bodies and stimulating growth factors from this perspective. And I like to microneedle this into the scar tissue.
So do you take for those who are not in the know, is that PRP that you're talking about? So where you take a sample of the patient's blood and then you spin it down in a centrifuge, and then you take the kind of straw-coloured liquid off top. So that that is the bedrock, isn't it? Really, it's basically to induce inflammation in a controlled way, and it's so important to choose a practitioner, is it, who understands what a controlled method of inflammation is. Because the one thing that I advise patients on is that, what springs to mind is downtime when we're doing that sort of treatment. It could be that they recover very quickly, but actually it may extend out. So mechanical microneedling, definitely. What device do you use in clinic? Or do you use
I use a derma pen.
Use a derma pen. So I use something similar. I use skin pen. But do you ever use any radio frequency or any machine-based sort of energy-based ablation or microneedling at all?
I don't use radio frequency, no.
So I guess that's a slight difference, is that so we've got a Venus Viva machine. So that provides a kind of radio frequency method of microneedling. But you were just about to say you've got something else up your sleeve as well.
Yes, in conjunction with the microneedling, there's a couple of other things that I do use. So I think this is what you picked up on. I use Carboxy Therapy.
Yeah.
So Carboxy Therapy is a very old traditional part of the aesthetic world, and it's little injections of carbon dioxide under the skin, which improves oxygen flow, improves blood flow and nutrients to the area.
Yeah.
So our bodies have to have an equal amount of oxygen and carbon dioxide to exist. So if our bodies sort of think that there's too much carbon dioxide in an area, it'll sort of rush oxygen and blood and nutrients to that area to heal. And so this is very, very beneficial in wounds. It's a very quick procedure, and it can be used in conjunction with a lot of other procedures. It's very safe with minimal downtime, and it's very painless. You find wounds often have minimal nerve endings anyway, so inject little tiny injections into an actual scar is very, very painless. So it comes down a sterile tube, and sometimes there's just a little bit of expansion where the gas is under the surface of the skin. So there's very minimal downtime, maybe a tiny little bruise from where the needle's gone in. But apart from that, it's straight back to work afterwards. It's quick and easy. And after, say, a few treatments, I always say nothing is ever a one-off treatment. We can't just go to the gym and have a size 8 figure. So it's the same with our skin health. It's multiple treatments over a course of time will get us to where we want to be eventually with our skin.
I mean, I've seen a lot of American clinics using Carboxy Therapy, but the thing is about social media is that you might see one treatment being talked about or mentioned, but this is the whole point of lives, is to get people used to the fact that stretch marks and scars, it's, as you just highlighted, it's a time-intensive process that can take potentially up to 12 weeks minimum, or even longer, depending on how long the scars have been there, which obviously the consultation is important. But no one treatment modality I've found has worked. So I think carboxy therapy is something I definitely will be looking into as an adjunct. But I'll use microneedling. I tend not to use PRP. I'll use growth factors from companies like or AQ and Anti-Age, where they're synthesized natural growth factors, if you can call it that. And injecting those in to the treated area, it does work really well. And then using also combinations of hyaluronic acid to replenish. But I find that one thing that clients, I think, patients find confusing is that it's never a standard set, is it? I mean, I've had patients come in and we've reassessed on the third treatment and gone, actually, you know what? We're going to add in some mesotherapy, or we're going to add in some cytokines or growth factors, or actually we're going to add in thermal ablation using the venous fever, or actually we're going to switch to microneedling now as our sole method of treatment. Do you find that patients get confused? Are you better than me and you tend to explain it really clearly to them?
I feel I always start with, now this is going to be a journey. It's never going to be, this is our strict plan or our strict regime and we're going to stick to it. I like to offer all the advice I can at the beginning and say this may occur or this may occur, but we're going to reassess at every step of the way, and our plan may change because your skin or your results or your scar has changed, and it may be healing quicker than we expected or a bit slower, and we need to just reassess the way that we're looking at it and the way that we're treating it. It's never set in stone.
Yeah, I mean, I always say to patients right at the beginning that we can, no one can ever say that they can get rid of your scars. It's always a case of we can reduce the appearance of them. And sometimes patients, especially I've had a few fitness instructors, we've reduced their scars right down minimally, but they'll message me after they've had an intensive day at work, and they'll say, "Oh, but the scars have reappeared." And like, they were always there, but you were much well hydrated, your skin health was much better, you were using the right products on a daily basis, and just think of the days off that you've had. Have your scars been there? No, they haven't. But actually, when they're when patients' skin health suffers a little bit, then they become more conscious of their scars. And I think that was something that we really wanted to talk about. We'll go back to scars again and kind of have a little bit of a summary, but what's your view on the kind of holistic approach then? We call it skin health, but how do you approach it in clinic, going from scars to then educating clients, patients?
I think it's a very hard time, especially with social media. We have to try and optimize our skin health, but there's a very big pressure on aesthetic practitioners to try and get that glowing skin, that perfect, flawless glow. And often I think this can be often compared to a baby's skin. And when you're talking about a 50-year-old, a baby's skin is flawless. It's juicy, it's vibrant, it's beautiful, it's flawless of scars. It has a good thick dermal layer, and trying to compare that for us when you have sort of films on social media and things, and people want to compare to that. There's always a tapestry behind that person. So we have to be very careful of trying to make ourselves look like the people do on social media, I think. And we can optimize skin health as much as we can, and we can optimize your journey, but we have to be realistic with our expectations where we're going to be at the end of it.
No, you've articulated it so well. So for anyone that's watching this back again later, we've gone from talking about some kind of scar treatments that we do, we talk about combination, we talk about the time intensity, and then we've moved on to a topic that's close to both our hearts, which is skin health, and actually giving a realistic picture. As you just, when you described that baby skin, I just wanted to pinch those cheeks, and that poor 50-year-old wouldn't get a look in. But it is so important, and scars are really intimate, aren't they? People, when you start, I found that when you're treating some people's scars and they're like, oh, it's going, you can see, one, there's a kind of happiness that the scars are reducing in size, especially stretch marks, I find, especially across the abdomen. When you show some patients before and afters, they're so pleased, but then there's that kind of almost a regret that, we just losing Amanda there for a second, so I'll feel, I don't know whether it's my Wi-Fi or whether it's Amanda's.
Sorry, the internet
that's
went.
Okay.
I
That's
don't know
okay.
what happened.
You missed out on probably nothing nonsensical that I was saying, but I was just saying about the realization from some patients when they, scars are very intimate, aren't they? And there's quite an attachment to them. Do you ever find that when you're treating them, that there's a bit of a...
I mean, my patients always go on a journey before they come to me, and it's always helpful for you to share that journey with me so that I can help you move forward. And some patients come to you with large surgical scars that I've repaired with multiple modalities. Stretch marks can heal, or they can soften rather than completely heal. We can't completely heal anything. A scar is a scar. But we can soften things and we can smooth scars, whether they're surgical or traumatic. But everyone has a journey, and often if you share it with us, we can become part of that journey and part of your healing process. Yeah.
So I guess, how are we answering the title of the discussion, can scars be healed? I guess scars are on so many different levels that in some aspects they can, or they can be smoothed out, but never, I suppose, fully healed, because they're part of that patient, aren't they? They're going to be there. It's a reflection on their life or what's happened. Just on, I know that people will be interested in this. Stretch marks. What's your go-to for stretch marks? How would you approach them generally? The ones that have been there for a while.
Yeah, I've had a lot of good success stories with softening them and smoothing them over with both plasma pen and Carboxy Therapy combined. But I think on the note of healing a scar, can we heal scars? I think scars mean different things to different people. So are you healing the scar on a physical appearance level, or are you healing it on an emotional level to where you're getting the patient to a point where they're happy enough to step outside with the scar? I think everybody, that's important. It's an emotional journey, and it's that patient's journey. It's not your journey, and you need to work with them. So if we can heal the scar a little bit emotionally and a little bit physically, we can help them on their way and help them in their growth.
I can tell that when you consult with your patients, especially because of your background as a midwife, you really do take them on. You do really join them on that journey. So that is, it's always refreshing to hear when someone else is saying that, because even as a GP, you've got such a short amount of time when you're answering or having to deal with whatever comes through your door or on the phone these days. But to be able to spend a little bit longer in clinic with patients, within time limits, of course. But it is so important to be part of that journey, and stepping out. We get good feedback. I've done some before lockdown. I did some stretch mark treatments with combinations of radiofrequency, mesotherapy, and also thermal ablation. And we reduced those stretch marks down by 80%. The side effects of using the RF is that you can also use it as for lipolysis, so that you get a smoother surface of the skin and a smoother the tummy as well, which is a bonus for my patients. But it takes time. I mean, that journey, the stretch mark journey, there were ups and downs on there, because some weeks it was like, has there been an improvement? The redness, the inflammation stays there for a couple of days. Wearing clothes is uncomfortable, but being past that journey, and hopefully in the summer when we can actually go out and enjoy the fruits of our labour, it will be beneficial. I could talk for ages about this. We've kind of just skimmed over a lot of things, but if anyone's got any comments, I don't think they have. They're all waving, which is nice, but no one's made any comments. Actually, Balsam from Derm Refine Clinic did. She's always got good questions, which is great. So she mentioned, she asked about atrophic versus, I think she meant hypertrophic rather than hypotrophic.
Yeah.
So for anyone who's not in the know, scars come in different shapes and forms. They can be kind of almost like an overgrowth. They go beyond the boundaries, or they can be indurated, and they can be sort of, how would you describe it? I mean, I've just really rubbished that all up and set you up for a second.
So with Carboxy Therapy, I can treat any scars apart from keloid scars.
Yeah.
But sort of atrophic scars are sort of sunken in, where the fat cells are sort of missing, or where you have a depression, or sometimes where you have a little elevation, but it's not too big. Most scars can be softened and smoothed pretty much right to the skin surface. In the past, I've had quite a large scar across this area here, which was a traumatic scar.
Okay.
And I have no makeup on at the moment.
Yeah.
So can you see that?
You can just see it now. Yeah, but you can't see it from the angle. Yeah, now I can.
No, but it's completely flat to the touch.
Yeah.
And the point that, so it had sort of a skin tag here, and that has been treated with multiple modalities. So that's been treated with the microneedling, it's been treated with plasma pen, and it's also been treated with the carboxy therapy, and multiple sessions. But it is now flat to the skin surface. I've got no makeup on there, and I feel comfortable walking out in the environment like that. So it's my inner confidence that matters, and that's all that should matter to the person, okay? It's the external appearance often matters, and that's why they come to you in the first place. That's why people approach you. But when they get to a point of feeling confident inside themselves and they feel a better person for it, then you've had a good result.
No, definitely. I can't agree more. Yeah. So, I mean, you nailed it on the atrophic, and Balsam did mean hypertrophic. So she was talking, as I said, scars that go beyond the boundary. And that's actually, that's why a consultation with a healthcare professional, because we know our limitations, don't we? So anything like keloid or hypertrophic, it should be referred to a dermatologist, because it involves probably steroid injections or something a bit more technical that's involved in secondary care. So, I mean, that's straightforward for patients. And then this is part of the education process. Atrophic scars can be managed quite well. Last question, I'm going to really pick your brain on this one, Amanda. So I've not really done much scar treatment with fillers. Yeah. I've kind of done the technical analysis. I've done the training. It's, because we've got such good treatments anyway, I've not felt the need to use it. Have you used fillers at all for treating scars?
So acne scars, when they're a little bit of an indentation, if you're unsure, I'd start off with injecting a bit of PRP, a bit of subcision. So scars on the surface of the skin, if they've got a little bit of indentation, they might have a little bit of fibrous connective tissue pulling them down. So that can just be nipped with a little needle, and then maybe a little bit of filler under it, or if you're unsure, a little bit of PRP, and then it'll dissipate.
Well, you answered that. You answered that perfectly, because it's combination. You can't. it's never just filler, is it? You've got to assess the scar, talk the patient through it, and then subcision, for anyone who's wondering, is where that kind of tag that's kind of pulling underneath the scar down. You can nip it with a needle. We'll use that phrase. You can nip it with a needle, which sounds much better than the way I describe it.
The other thing is skin boosters. I've filled acne scars with skin boosters, and that's very successful.
Which ones your go-to? I mean, I tend to use Profilo in clinic. Is that something that you use, or? Yeah,
Profilo, Viscoderm Hydra Booster.
Yeah, very good, very good. I've not used it, but when I did my Profilo training.
It's amazing for fine lines, especially accordion lines. Anywhere there's dynamic areas that are difficult to treat, it's very amazing.
Yeah. Agreed. Again, someone coming in with acne scars, and Balsam's come through with a question. So subcision and fillers for all scars of acne or icepick scars. Yeah, I think so. But again, it's a combination, because you might do filler, and then actually you might prescribe retinol. So I've done that in the past, where I've done skin boosters, and then I've put a prescription retinol and skin health program, where they've then carried on using that, and then it just improves the appearance. Or I've done it 4 weeks in advance before they even have to come into clinic, and I think 50% of the time they don't actually need to come into clinic, because they're happy with the improvement with prescription grade treatment, I should say. So I mean, do you have that approach at all, where you're prepping them beforehand? Yeah,
absolutely. Professional in-clinic treatments are only the icing on the cake. At-home treatments are the basis, the most important thing that you can be doing every day for your skin health. We need to only be thinking of in-clinic treatments as a bridge, and focusing on our day-to-day routines at home. That's the most important thing that will keep our skin healthy. We're taking responsibility for our own health and for our own skin health from the inside out.
From the inside out, no, definitely. And don't get me started on nutrition and supplements. So
we're going to be here all day.
Okay, we would be. So, I mean, you wouldn't go to a dentist and have a treatment and not brush your teeth afterwards. And it's the same for skin. And it's, again, not getting distracted by the shiny stuff that's over the counter. I mean, yes, everything has a place. I mean, I'm all for luxury products, that kind of thing, that the luxury skin product that you want to use on your night out when we do get to go out, or something that's fragranced as a one-off use. If we're let out, yeah. But generally, day to day is where you achieve the most.
Absolutely. I mean, if you're spending so much money on fillers and everything else that you're putting into your face, skin boosting treatments, expensive in-clinic treatments, but you're not doing the daily basic skincare at home, then you're wasting your money. You can prolong the life of your fillers just by one simple thing: putting sunscreen on your face every day, blocking those UV rays.
Yeah, I mean, I say that to patients. I've got cream in clinic that reduces aging by 80%, but you can see their faces just sink when I say it's sunblock or sunscreen. Yeah. They think it's going to be something exciting. Amanda, we've covered quite a lot, and I think what would be really nice is that, let me do a quick run through. I'll just give you an idea of who's joined us. Quite a long list, amazingly. You must be quite popular, more than I am. So Cosmetic Perfection, I think that's Emma. I could be standing corrected. Calve's joined us. Olivia, thanks for joining us. Amy, Garden Retreat. Sparks Taylor, Skin Tonic. Balsam from Derm Refine. RN Aesthetics. Michelle from MWA Aesthetics. So one of our kind of fellow business colleagues. Zoe joined us as well. Natalie, thanks for joining us. That's Colchester Haswell Aesthetics. Looking forward to seeing some more social media from them. Being a bit quiet. Dr. Patel, who's Veda Skin. Josephine, Dr. Rita Rackers joined us as well briefly, thank you. Balsam with the questions. Stevie, I think Stevie Potter's actually on her, she's training at the moment, so she must have just switched us on to keep her motivated.
I hope that's worked.
Maybe it's worked. The Chief joined us as well, Richard Crawford Small, thank you. And Jodie, thank you as well. So yeah, quite a bit of interaction. So that's really exciting. So last word for you then, Amanda, because you're the guest on my team.
Thank you very much for having me, and it's been a great pleasure. I hope we can help lots of people out there Scars can be very damaging, and that's what we came here to talk about today. So if you have a scar and you're worried about it or concerned about it, just give us a call and we can have a chat about it, and we can often improve other areas of your life as well.
Okay, so a quick hello to Stacey, who's just joined us. I'll say hello. But thank you everyone for joining us. If you'd like us to do another one on scars, I mean, that could be our series before we go into when we open clinic, please do DM us or DM me, and I will I'll twist Amanda's arm and get her to join me again for Monday. But thank you so much, Amanda, and I'll speak to you soon. Take care.
Thank you for your time. Bye-bye.
Hi everybody, sorry, stuck there for a moment where I thought I wasn't live, but obviously clicking live means you're going to go live. So this is round 2. So I'm going to be joined by Amanda, and today our